Oh, hi! Welcome to Clinica de Bardonido, and we're going to talk about the elbow joint. What is the elbow joint? The elbow joint is formed by the articulations of the humerus, radius, and ulna. The ulna is articulated with the trochlea of the humerus, and the radius is articulated with the capitulum of the humerus. So, the elbow joint is a trochleogynglimus joint, and it allows the action of the flexion, extension, pronation, and supination. So the muscles that allow the flexion of the elbow joint are the biceps brachii and the brachialis that is located at the anterior aspect of the arm and is innervated by the musculocutaneous nerve, while the extensors of the elbow joint are the triceps brachii and is located at the posterior aspect of the arm and is innervated by the radial nerve. So the muscles that allow the supination of the forearm are the biceps brachii, which is located at the anterior aspect of the arm to the forearm, then is innervated by the musculocutaneous nerve, and the supinator, which is located at the posterior aspect of the forearm and is innervated by the deep branch of the radial nerve or the posterior interosseous nerve, and then in the mid-prone position, the muscles that are located here is the brachioradialis, which is innervated by the radial nerve. So for the pronators of the forearm is the pronator teres, which is located from the medial epicondyle to the radius, is innervated by the median nerve, and the pronator quadratus, which is located at the distal part of the radius and ulna, and is innervated by the median nerve as well.
So the elbow consists of three ligaments, and the two of those are the collateral ligaments, or the ulnar and the radial collateral ligaments, and the annular ligaments. The annular ligament makes a collar with the radius and stabilizes the radius in the elbow joint.
Oh hi! Welcome to Clinica de Bardonido. Now, we're going to talk about range of motion. Per se, range of motion is a measurement of movement in a joint. Each joint in the body has corresponding values regarding the range of motion. For the elbow, specifically, we have 0 to 150 degrees for elbow flexion, 150 degrees to 0 degrees for elbow extension inversely.
According to Norkin and White's Guide to Goniometry, the universal goniometer is the instrument most commonly used to measure joint position and motion in the clinical setting. It is composed of a fulcrum, a distal, and a stationary or proximal arm. These are used to measure the range of motion of joints in the body. Elbow flexion can be measured by placing the fulcrum on the lateral epicondyle of the humerus with an alignment of the proximal arm at the lateral midline of the humerus with a reference point of the acromion process. The distal arm can be placed in the lateral midline of the radius using the styloid radial process as your reference. Normal values for elbow flexion are 0 to 150 degrees with an end feel of soft in the position at supine. In measuring elbow extension, the position of the patient should be in supine with the shoulder in 0 degrees, arm close to the side of the body. The landmark for the fulcrum will be at the lateral epicondyle of the humerus, while the proximal arm is at the lateral midline of the humerus, at the center of the acromion process as a reference, and the distal arm at the lateral midline of the radius, given that the radial head and radial styloid processes are your references. If elbow pronation will be measured, the patient should be sitting with their shoulder in 0 degrees, arm close to the side of the body, flexion of the elbow to 90 degrees, and position the forearm midway pronation and supination so that the thumb points upward. The fulcrum should be at the ulnar styloid process, while the proximal arm should align to the anterior midline of the humerus, while the distal arm is at the dorsal aspect of the forearm, parallel to the styloid processes of the radius and ulna. The normal value of elbow pronation is at 0 to 80 degrees, while it has an end feel of hard due to bone-to-bone contact. In measuring elbow supination, it has a normal value of 0 to 80 degrees and an end feel of firm. The landmark of the fulcrum should be at the ulnar styloid process, while the alignment of the proximal arm should be at the anterior midline of the humerus. The distal arm should be at the ventral aspect of the forearm, parallel to the starlight processes of the radius and ulna.
Oh hi! Welcome to Clinica de Bardonido. Now, we're going to talk about manual muscle testing. First, what is manual muscle testing? It is the test used to assess the strength of the muscles of the individual. In assessing the strength of the muscle, there are two techniques that are commonly used, one of which would be the active resistance technique. Active resistance technique is an application of manual resistance against an actively contracting muscle or muscle group. Second technique is a brake test. What is the brake test? The brake test is a manual resistance applied onto the limb after it has completed the full range of motion after the examiner has positioned the limb until it breaks. In assessing the strength of the muscle, it is graded from 0 to 5. Grade 0 meaning it is the lowest, while grade 5 would be the highest. Grade 5 would mean that the muscle is able to make a complete and full range of motion with gravity against it and with maximum resistance by the physical therapist. While grade 4 out of 5 would mean that it is able to make a complete range of motion, however, with only moderate resistance. While grade 3 out of 5 would be able to make a full range of motion but with no resistance applied. While 2 out of 5 would also mean it is able to make a full range of motion but it is now gravity minimized. And grade 1 out of 5 would mean there is no complete range of motion and there is only palpable contraction from the muscle, while 0 out of 5 would mean that there is no contraction at all.
In elbow flexion grade 5 to 3, the muscle involved is a biceps brachii, and the position should be short sitting with the elbow flexed at 90 degrees. Check available ROM, then palpate the muscle. Begin at grade 3 full ROM without resistance but still gravity resisted. If patient seems strong, grade 5. Grade 4 if moderate resistance. If patient has weakness, test grade 2. Position the shoulder at horizontal abduction. In grade 1, there is only palpable contraction, and for grade 0, there is no contraction at all. In elbow extension grade 5 to 3, the muscle involved is the triceps brachii. The position should be prone. Check available ROM, then palpate the muscle. Begin at grade 3 full ROM without resistance but still gravity resisted. If patient seems strong, grade 5. Grade 4 if moderate resistance. If patient has weakness, test grade 2. Position the shoulder at horizontal abduction. In grade 1, there is only palpable contraction, and for grade 0, there is no contraction at all. In forearm pronation grade 5 to 3, the muscles involved are the pronator teres and pronator caudatus. And the position should be short sitting with the elbow flexed at 90 degrees. Check available ROM, then palpate the muscle. Begin at grade 3 full ROM without resistance but still gravity resisted. If patient seems strong, grade 5. Grade 4 if moderate resistance. If patient has weakness, test grade 2. Position the elbow flexed at 90 degrees and palm facing towards the face. In forearm supination, the muscles involved are the supinator and the biceps brachii. And the position should be short sitting with the elbow flexed at 90 degrees. Check available ROM, then palpate the muscle. Begin at grade 3 full ROM without resistance but still gravity resisted. If patient seems strong, grade 5. Grade 4 if moderate resistance. If patient has weakness, test grade 2. Position the elbow flexed at 90 degrees and palm facing away from the face.